Welcome to the Who Knows This podcast, where I track down in the trenches experts to answer questions that we all want the answers to. I'm Sam Visnic, and I'm a veteran in working with people with chronic aches and pains by way of massage therapy, exercise, pain education, hypnotherapy, and lifestyle education. Today, we're going to talk about how to get radical relief from chronic pain with pain science, mindfulness, and acceptance and commitment therapy. So let's get started. Okay, welcome. And as a quick intro here, as usual, I'm going to read a bio here so you know who our guest is. Dr. Joe Tatta is a global leader in integrative pain care and an advocate for the safe and effective treatment of chronic pain. He's the founder of the Integrative Pain Science Institute, a cutting-edge health company reinventing pain care through evidence-based treatment, research, and professional development. For 25 years, he's supported people living with pain and helped practitioners deliver more effective pain management. His research and career achievements include scalable practice models centered on lifestyle medicine, health behavior change, and digital therapeutics. He's a doctor of physical therapy, a board-certified nutrition specialist, and acceptance and commitment therapy trainer. Dr. Joe Tatta is the author of 2 best-selling books, Radical Relief and Heal Your Pain Now, and also the host of the Healing Pain podcast. So let's welcome him and get started. All right, so here we are, Dr. Joe Tatta. Thank you so much for being here. This is going to be an exciting one. We have a lot to talk about with all things regarding pain. So thank you so much for being here.
Hey, Sam, it's great to meet you and it's great to be here.
So the big first question I have is, as a physical therapist, what got you moving into this direction in terms of, I don't want to encapsulate it just as pain science, but into the direction of all things around the concept of pain that you do? What got you going in this direction?
Part of, it's a lot of different factors. I mean, part of it is the direction that the evidence is headed in. Part of it is just recognizing and kind of reflecting on my practice, what I've done over the course of almost 3 decades, what's worked and what hasn't worked and what was missing. And then some of it's just my own personal interests in things that I've observed either in the clinic or I've observed with myself or colleagues that started me kind of on this track of looking at, okay, what is it about pain? It's obviously more than just a physical sensation. It's more than just how our body moves, although that is a really salient factor in the rehabilitation of pain. But just looking at a little different things, mind, body, brain, even looking at, how our mood and spirit is impacted by pain.
Yeah, and you mentioned there's a quote on your website, and I'll bring this up, that less than 1% of overall healthcare training is devoted to treating pain. And to me, this is quite bizarre. So I always like to ask clinicians, and there oftentimes is a big gap here that once you go through school, now physical therapy is a DPT program, so it's advancing. So do they talk about these concepts in school? And so what has happened here that so much, and let's, specifically related obviously to the PT field, is this information not really covered or emphasized? What's going on out there?
Yeah, I mean, if you look at healthcare training overall, so that's training of, physicians and nurses and physical therapists, occupational therapists, massage therapists, nurses, just the health professions, the licensed health professions overall is really where that quote comes from. So if we go into the curricula, the university curricula of any profession, the amount of content there on pain is quite low. It's actually significantly low, considering most of us are going to school for at least 2, 4, 6, 8 years, so to speak. When you start to move into 2 professions, one being physical therapy, there's probably the most in a physical therapy curriculum at this point, which is pain-specific content. And then you can look at a psychologist's curriculum. They have a lot in there about behavior change, but not specifically related to chronic pain. So when they come out of school, they usually have to figure out how does this apply to pain, but they have some of the behavioral principles down pat, which is important. But why it's not in there, is a good question. Some of it is embedded within the curriculum in different areas, so it's not a particular course, so to speak. But I think more and more we're seeing that, okay, we need to dedicate specific courses and specific coursework to what is the study of human pain and suffering, because it is really the number one symptom or complaint that people have when they see really any practitioner.
That's the bizarre part, is that considering it's how many people are showing up. But in my coursework is nowhere near as advanced as yours, but I've been doing this for about 20 years as well. And I got kind of swept up into the corrective exercise kind of phase of things where everything was moving into functional training. But there's this almost inherent presupposition in all of that work that the mechanical issues or the muscle imbalances and all this other kind of stuff that we were taught was the reason why somebody had pain. So nobody ever talked about the pain. And from a neuroscience perspective, what's actually happening when people have pain, it was almost straight away taught, and that assumption was embedded, that if somebody has bad posture, that's why their back hurts or their shoulder hurts or whatever. And for me, this pathway took many years of, just as I just did my work, figuring out, well, this person's posture is better or their abs are stronger, that this person still hurts. And I think early on, and it never really hit me, but I used to tell a colleague, I was like, I'm finding that a lot of times I'm just trying to convince people that if they do an exercise, their spine is not going to break in half. And then as they do that, they feel better. So I think that, some people have different pathways of going through this, but for me, it was a matter of starting to question what it was that I was doing and starting to but then we were lost. We were in a gap of trying to figure out, okay, well, it took years for me to determine where to learn more. And early on, I became interested in hypnotherapy. And actually, funny enough, that hypnotherapy had taught me a lot more about dealing with people who have pain because they didn't do any physical stuff with people. And that really got me interested in saying, well, you could talk to people and you can help them relieve pain. But there was still a big gap in putting all that together.
The journey that you're saying that you've been on is common for many practitioners. And you mentioned the word bizarre. It's bizarre and it's not bizarre. It's not bizarre because for the longest time, for decades, really, for probably half a century, when people had pain, we prescribed them a medication. And we didn't talk about the brain or the nervous system or any other system in the body for that matter. We just said, hey, take this medication and keep taking it to manage your pain. And we know that obviously went to a very bad and scary place for a lot of people with opioids and with other medications that are out there now too, like gabapentin. So then the other part of it is, well, if that didn't work, then we're going to do surgery, right? We're going to kind of cut open the area wherever the pain is, and we're going to kind of go in there and fix it or replace it. And we now even know with total joint replacements, things like total knee replacements, total hip replacements, 20% of people that undergo a total joint replacement still have persistent pain in that joint. So think about that. You've taken the whole joint out, you've replaced the joint, but someone's pain is still persisting. So this is when people like you and I are saying, well, what else is going on here, right? And we really shouldn't be the ones saying that. People who are doing the surgery and prescribing the medication really should be saying, well, I keep prescribing these pills and people aren't getting better. What's going on? And people like you and I are saying, well, there's something else happening other than the medication and the surgery point. Let's start to look at the whole person. So the bizarre part is, unfortunately, it's taken us so long to get here. The not bizarre part is when you start to really, listen to someone's story and go back into their pain story and their life story, really, and start to put the pieces of the puzzle together for them. It starts to make sense on why people have pain. And you hear things like, well, I've had trauma in my early life, or I currently have a very stressful life. I'm not moving my body because I'm sitting at a desk, 8, 9, 10, 11, 12 hours a day. So I'm really sedentary. We know that being sedentary is a risk factor for pain. So, people like you and I start putting the pieces together for patients, and it does take a while. But once those pieces come together, people say, okay, now I have a better picture. I can actually, make sense of what's happened to me in this pain experience, and didn't just start yesterday. Most of these things, it takes a number of years, sometimes even decades for pain to develop.
So let's back up and talk about one element in there, because there's a lot to unpackage here. And when you talk about pain being an experience, and there's multiple pieces that are going on to this, how does this work? Because we had mentioned, first of all, I was saying that pain is not this purely biomechanical thing, right? So you could take a joint out and then put in a fresh one, a brand new one, and all of a sudden person still has pain. But then we have all these other components, like how does stress play into it? So all of it kind of happens once. And I think people really have a hard time. I mean, I even do, still wrapping my head around how this whole kind of matrix fits together. So how do you perceive that? And how have you kind of untangled that for your own, for the way you view things and how you do things in your practice?
Yeah, I mean, these are really, good questions for us to talk about as far as professionals and even for the public to start to hear us conversing about them. And as they hear us conversing about them, they start to get some aha moments. But essentially, your nervous system, which is your brain, all the nerves throughout your body, is concerned with safety first and foremost. That's really what it's concerned about, is safety. Is what's going on inside my body and is what's going on outside my body in the environment something that could potentially cause harm or something that makes me feel safe. Now, when we talk about things that's going on outside your body, those things have an impact on what happens inside your body. So the things you see, the things you hear, things you smell, the things you taste, and the things you sense, right? So sense comes through all parts of your skin. Those are your five senses. Your five senses bring information from the outside world in, and it informs your body of what's happening in that outside world. So if you are, let's say, in a car accident and someone hit you from behind and you felt your head kind of go forward and hit the steering wheel and then go backwards and hit, let's say, the back of the seat, all that sensation, all that entire experience, right? The noise of the wheels screeching, the impact, the sensation of your head, your eyes seeing the steering wheel, all that imagery comes in basically. And your brain starts to put a picture together and say, hey, is this an environment where I'm safe or is this an environment where I'm in danger? And if you're in an environment where you're in danger, your body is going to do two things. One, it's going to go into a fight or flight response. So it's going to try to escape and get you out of there. And two, it oftentimes produces pain as a motivating factor. So when you have pain, obviously you pull your hand away from things. Like if you put your hand on a hot stove, you pull your hand away from the heat. But your entire body can be the thing that you withdraw from pain in many ways. So that's kind of what's happening on the outside world. Then in the inside world, it's, well, what are the thoughts, the emotions, and really what's the chemistry of my overall body? How is that impacting the state of my nervous system and the rest of my tissues?
So, and I hear, and this is such a great discussion, I think, for people to understand how many components there is. And this is not even talking about the actual damage to the tissues, right? So we could have pain before we even have tissue damage, correct?
You can have pain before you have tissue damage. You can have pain with no tissue damage at all. That's possible as well. I think a good example of that is people who suffer with major depression, where they don't have an actual physical injury. You might say that's a psychological condition. Most of those people have physical pain as well as emotional pain. So that's where you see the emotional component really come in. Now, you don't have to have major depression to have somatic or what's known as bodily pain. You can have that just with stress. You'd be surprised that a moderate amount of daily stress, day in and day out, actually can cause pain.
Now, do we have an explanation at all for where that pain does present? So, for example, why is it your back and why isn't it the big toe for the individual? Does there have to be some kind of pre-existing problem, or what we would call nociception for those of us listening would know? Does there have to be something else present? Is there any information about why these things present in just a stress condition without any injury?
Yeah, we're not 100% sure. We have some clues basically that come out of the body of work around stress basically. And when you're in that fight or flight response that I mentioned earlier, if you're fighting using your hands and upper arms, or you're fleeing using your legs, those are the big muscles of your body. So all of your energy, so to speak, your blood and all the energy is shunted to those muscle groups. The muscles around your spine, which are the smaller, kind of more delicate muscle, oftentimes the blood is shunted away from those areas. And when that happens, tissues become hypoxic, or you lose blood flow and you lose oxygen there. When your tissues don't have blood flow and they don't have oxygen, they become hypoxic and that doesn't feel well. It starts to kind of, in the beginning, it starts to ache. If that happens over time, then obviously you develop things like chronic pain. The other thing is in fight or fight situations, those muscles oftentimes tense up so they contract. And if you're in that persistent state of stress day in, day out, those muscles will stay contracted. That's why people who have stressful jobs where they sit in chairs and they're not using their physical body to move blood around their body, they're not bringing blood to those tissues. Every tissue in your body needs blood and oxygen. And they're under stress all day long. So they're in the chair stressed out and those muscles are tightening up. That's why for many people who work at a desk, things like yoga and stretching and Tai Chi feels wonderful for them at the end of the day. And it's a way for them to manage their pain because it brings blood flow to the area. It stretches muscles that have been tight all day long. And it also just helps with general relaxation and stress relief, which is a nice kind of mind-body component to it.
So, and that sounds very much like that kind of explanation where people are just sitting and they're just tired. They're tired not even doing anything because they're just sitting in a state of having, whatever we want to call it, those postural muscles are holding tension just because they're tense. And that may or may not, I don't know if you agree with me, be associated to posture, because you could still have good upright posture, but if you still have tension, you're still getting tired. So you could have bad posture and be relaxed. You could have good posture and be tense, right?
That's true. And then when you say tired, I just want to talk about fatigue for a second. Even though we feel fatigue in our bodies, like if you went out and ran a marathon, you would say, okay, that exercise or that physical activity fatigued me. But what many people face today is cognitive fatigue, a psychological fatigue, if you will. Most of the jobs we have today have to do with problem solving and executive function, which are brain-based, processes. And, the work we do today is very different than the work we did probably a century ago that was more physical labor. Now we're doing more kind of psychological labor. And there's a fatigue level to that as well. And whatever happens in your brain happens in your body. So any process happening in your brain, things like fatigue, psychological or emotional fatigue, does have an impact on your body.
Yeah. And of course, I can imagine how, and those are the listeners that sound familiar, like when you have those kinds of demanding mental jobs all day long and you are tired, it's very hard to motivate yourself to exercise after that, isn't it? Especially, going to the gym and being aggressive and so forth. So that's one big can of worms there to deal with, right? So people have, stress, become tired, causes tension. They don't want to exercise, don't want to move as much. And then that facilitates the pain cycle. Yeah.
Yeah. I was just reading a study. I can't remember which journal it was in, but they looked at people who are stressed at work and what they did to alleviate their stress. And at the end of the day, many people said, well, I went on social media because it allows me to kind of move my mind away from work and onto something different. And what they found by going on to social media is that it actually increased their stress and fatigue level. So after you've been engaging with a screen, and really talking about screen time here, after you've engaged with a screen all day long, the best thing to do is close the phone, close the computer, close the laptop, close the iPad, whatever it is, and start to move your body. And it doesn't have to be in a very aggressive way. Just a simple 10-minute walk can kind of reset all of those processes and you can feel better.
And that sounds very simple. And I think there's a lot of struggle these days with, and again, I always kind of circle back to this because it seems to be kind of what we're experiencing out there is this uber complexity of movement programs, right? All of this super duper corrective stuff. And, of course, I've been involved in this in the past when my mindset was predominantly based upon that. And I do think that stuff has a place, learning how muscles work and improving joint motion and so forth. But if people feel so overburdened and overwhelmed by that, without realizing that just getting up and moving by itself is super helpful, they're going to start winning by just starting to take some action and moving.
That's right. And so many people, with people with pain, they're oftentimes scared to move. So they've heard this message before, both from both of us, that movement is medicine and movement is healthy, but they go online like we do, and they watch television like we do, and they see people running marathons and lifting really heavy weights. And without even thinking about it, they say, well, this isn't for me. The message we have to get across to people, especially people with pain, and even the average person doesn't have pain, is that within 5 minutes of physical activity, and this is not intense, just very light, moderate physical activity, which could just be walking. Within 5 minutes, pretty much every essential bodily process that you would like to turn on that promotes health starts within about 5 minutes. And that also includes the processes that help with alleviating pain, that reduce what you and I know as nociception and release positive chemicals in your nervous system, which are opioid-like chemicals, which reduce pain. That happens within just 5 minutes of probably light to light moderate exercise. So I think one of the biggest things, even as professionals, when people come into our clinics, we're trying to work people up to 30 minutes of exercise, and start low, go slow. The place to start is really just 5 minutes of any kind of light to moderate activity of any sort, and you'll start to notice a benefit probably within about 1 to 2 weeks.
I've noticed that as well with anybody walking in the door, and that's where I think the specific exercise does come in with the individuals that are afraid to move, depending upon what they have going on and what their experiences are. That I can give them super specific, corrective exercises and movements that they feel non-threatened by. It's not so important that the movement perfectly fixes or does anything in particular, other than it makes them feel like, hey, I could do this and it doesn't make me feel worse. And if I can get them into that type of program, feeling more comfortable, and some people can't even walk. I mean, depending on what they have going on, they go out for a walk, they have plantar fasciitis or their hips hurt. I think that is where these things can come in. And mostly, of course, I'm sure you're aware of this, but for the benefit of the listeners, is just what you're presenting with, right? And the goal is to just start moving, and your movement might be dictated based upon those issues that you're dealing with. So maybe some calisthenics or certain types of exercises might be better. Some people can go out and walk, and then they should go out and walk. But movement is the key, right?
Yeah, that's right. I mean, when people lose their physical capacity, so physical capacity is things like their strength, their range of motion, their balance, their ability to lift and generate power. Like, that's what your body was meant to do. We know that when people lose their physical capacity, it's a risk factor for pain. So that has to be part of the program. Does it have to be a very specific exercise program that people follow every single day? Not necessarily. Yes, if someone comes to see you and they lack 30 degrees of range of motion in their knee, then sure, we have to normalize that joint, the function of that joint. But once the joint function and structure and capacity is normalized, then it's okay, how do we keep moving your body in a healthy way so that you either maintain or build that physical capacity, because people do lose physical capacity as they age. And as you're starting to increase your physical capacity, let's take a moment to just notice how it impacts your mood. Because as your body's getting stronger and your movement is getting better, your mind is getting better and more resilient. And those things, the biggest disservice we've done, I think, in our exercise culture, if you will, Sam, is we've kind of separated, when we just move our body, we get stronger, and we have to do something else for our mind. And it's actually, no, movement is one of the most powerful mood boosters we have. So if you're struggling with anxiety or depression or even PTSD and trauma, we know that movement is an essential part of those rehabilitation programs. And without it, people don't do as well.
I read somewhere, and I can't remember where it was in one of the articles that I referenced that I wrote on my website, that there are, I think with the exception of very, very few conditions, very few, that exercise was indicated for virtually every condition you can imagine. It's the one thing that virtually works for everything, with the exception of certain types of conditions.
Yeah, can you think of one condition from that article that they said it doesn't work for?
I would have to imagine it's just like, so I don't know, maybe if you have an out of control immune system and you can't go outside, or like, I don't even know, that would even make sense, because if you can breathe, I told people, if you can breathe, there's probably an exercise you can do for that. And anything, like if you're in a full body cast, you can do eye movement, right, to trigger some reflexes. So I don't know if even then what conditions they might be referring to, but virtually everything, if you're awake, there's some kind of movement going on.
Yeah, I mean, back in, when you say awake, a couple of things. First, you mentioned, if you can breathe, you can exercise. And one of the first exercises we often do with people who have, kind of the worst pain is we start them on breathing techniques, right? Because your diaphragm is a muscle. And when you start to exercise that muscle, it promotes relaxation and calm and a sense of ease and steadiness in people. So if you literally can't move, that could be the place to start. Let's just exercise the diaphragm. Let's just breathe, basically. And that's a really powerful modulator of the immune system and your nervous system. And then, I can think back to like early in my career, there were people that, were in horrific accidents who were in comas. And I was the physical therapist who was assigned to the ICU, and they were unconscious, some of them for months, who had contractures. And I would go in and I would exercise with them. I would move their joints. So, you're really seeing movement applies across the human lifespan at every age, every diagnosis, and every condition. We have to get better at saying movement is an essential component of your overall health and well-being, above and beyond anything. Like, that has to come first, because we are physical beings. We were meant to move our body. And if you want to enjoy any part of your life, chances are somehow you have to move your body to engage with things you want to engage with.
Absolutely. And we're going to dovetail right into this next piece that goes off of this, is a lot of it is education. And so the more we teach people, because in some way, I think obviously we have to kind of remove some of the faulty beliefs and some of the stuff that people are taught. And I think one of the things that people run into is how simple this sounds. And, my problem is different. Maybe I can't just walk, or I can't just move, or whatever, because of XYZ, usually coming with a diagnosis. And I think this is where, as we talk about with your book, for example, pain education, what is the real value of pain education? And I've seen some results from, I always think I might say his name wrong, but Adrian Lau is his last name. But I remember seeing an MRI that talked about this and says that people's brains actually look differently on functional MRIs when people are actually taught about pain. So where do you see pain education in the process, and how crucial is it? Do everybody need pain education? Do just some people? How do you perceive pain education?
So there's pain education, and then there's pain literacy. So let's start here. So health literacy is one's kind of an idea of what's happening to them, what the condition is about, and that what they can do to impact their condition. So health literacy can apply to pain. You have pain literacy. It can apply to mental health. There's mental health literacy. There's all different types of health literacy. So health literacy is the one thing that we're concerned about as practitioners. We want to make sure that people have a foundational understanding of what's happening in their body and the things they can do to help themselves rehabilitate and recover. Pain education is the process that we use in practice or in an education setting, like a university setting, to educate either the patient or to educate practitioners about the science of pain, if you will. Pain education has a place in clinical practice. We're seeing pain education kind of went like on a upward slope, and I think now it's kind of leveling off somewhat, because we know it has some type of positive influence when we help people understand what's happening. But it's kind of like the first, like if you're cranking one of those old cars, you kind of crank around and around. It's kind of like the first circle of the crank, where you give people some information about their diagnosis. You help them understand the difference between acute pain versus chronic pain. And then you help them understand kind of how they wound up in pain, if that's confusing to them, and what they can do. Beyond that, after what pain education does is it helps people, like I said, as I mentioned, understand pain. So it gives them some knowledge, and it probably decreases a little bit of fear, so that they can now start to move their body again and realize that there's much more happening than just their physical movement. So that's my take on pain education. I think it's an important component of pain education, of an overall pain rehabilitation program, but it's one component, and we shouldn't kind of leave out the other components.
And this is where I think we get interesting and moving kind of into your book, because when I first learned pain neuroscience education, probably like many practitioners, I was on a crusade now to educate everybody about it. And it's a lot. And, frankly, even in the beginning, I had generated slideshows and this process on the first visit to teach people about what was going on, because oftentimes it was scary diagnoses that they've had, or somebody herniated a disc multiple years ago, and now they're saying my disc hasn't healed, I'm in pain now. And for me, it was trying to unravel all of that, and a mixed bag. I'd say generally most people were interested in what I was talking about. The information was very overwhelming, but we run into one key problem almost always, is integrating it. is
Yeah.
kind of like, I understand it from a left brain logical kind of concept, but then you have to ground it in, because I'm still going to do massage therapy with somebody. I'm still going to do movement and bridging the gap with those two. But then there was a gap in the continuing to progress that. So as my hunt, as I was looking around, always reading information, I stumbled upon your book, Radical Relief. And of course, for listeners, we'll put a link to that. And you really expanded that. You took the information, and it's not just pain science, but it's now almost like some activities to really kind of draw people into learning about their experience. And in particular, we started off with a little bit of the pain education, some of the things that we had talked about in the book, but then you go into talking about ACT therapy. Can you talk a little bit more about that and how that is kind of like the connection to the pain education?
Sure. So I wrote the book. If you look at the first chapter of the book there, the chapter there is called Understanding Pain. And that's what we just kind of spoke about a couple moments ago, is that there should be some component of pain education, really, in any approach to pain rehabilitation. The challenge I found when I educate practitioners on pain education is they take these kind of really high level technical concepts, including the language they use, which is quite high level language, that things like central sensitization. That word alone is an extremely loaded word that even most practitioners really can't explain in layman's terms. And they plop this down in front of the patient, and the patient kind of has this sense of, this sounds important and it sounds like it's really technical and someone's trying to help me. And that some people are actually very interested in it and some people aren't. But again, it doesn't have the functional impact that we hope for as professionals. So it could, in one way, it could be a foundation. What I advise to practitioners when they start to lay that foundation with pain education is that it has to be really kind of basic. It has to be provided at a level that's probably at like about a 6th grade science level, so people can access that information, because the average American reads at probably about a 5th grade reading level. So using words like central sensitization is very confusing to people, because they don't know what that means.
Yep.
Where you just say sensitive nerves, or is something that's completely different. So the delivery of it is a big factor, Sam. And I think that's our responsibility as practitioners, to make it simple and to make it easy for people. Then beyond that, the research is quite clear. After you've done some foundational pain education, you really should be using cognitive behavioral techniques, no matter what type of practitioner you are, and weaving that within your care, whether you're a PT or a massage therapist or a psychologist. That typically is the direction it should go in next. So there's lots of different cognitive behavioral approaches. The one I use is called ACT, or acceptance and commitment therapy. ACT blends kind of traditional cognitive behavior elements with some more mindfulness. So I like it because it's kind of like a kind of a double whammy, where I can work on the more traditional cognitive behavioral aspects of things, as well as the more mindfulness aspect.
Okay, so what does ACT therapy consist of? What are we doing with ACT therapy?
Yeah, so ACT stands for acceptance and commitment therapy. What you're doing is you're training a core positive psychological process called psychological flexibility. Again, another kind of big term there, right? Psychological flexibility. What does that really mean? Well, it means that sometimes in life, there are some things that we have to face that can be really difficult and challenging. Pain, physical pain can be one. And along with physical pain, sometimes there's emotional pain, fear and anxiety that comes along with it. So there's a set of skills that we teach people that help them to be more aware of what's happening in a way that's kind of non-judgmental. And we help them kind of open up to these experiences or sensations, if you will, if it's in line with their personal values. So the things that are important to them in life. So we're not asking people to open up to pain or to allow pain to be present just for the sake of tolerating pain. We're teaching people how they can start to approach pain in a way that's healthier, instead of shutting down or avoiding it if it's in service of your personal life goals or values.
That's interesting. I'd love to hear probably an example, a specific example of that. Do you have one that's like a favorite kind of approach or a technique or something that you might want to share about that?
So you're talking about a specific technique or approach from ACT, if you will?
Yeah, maybe something that's kind of a run-of-the-mill type of issue that somebody might be experiencing. Let's say, they're chronic knee pain and they can't hike as much as they want to, for example.
Yeah, great example. So let's say you're someone who has been a avid hiker your entire life, and you've been healthy, and one weekend you're out on a hike and you kind of quote unquote twist your knee on a hike, and you go to the doctor, and the doctor says, "Well, you have a meniscal tear there. I want you to be very careful when you hike, and if it doesn't get any better, then we're going to have to go in there. We're going to pull that piece of cartilage out, and we'll see how you do that." Now, some people may go back to hiking and have no problem and recover just fine. Then there are other people that walk out of the office and they're scared, right? There's a lot of fear present. And they're thinking back, right, into the past, or their mind goes into the past. And they're saying, "Oh, what was it? Was it did I step the wrong way? Was my foot in the wrong position? My grandmother had arthritis. Maybe I'm developing arthritis too." So all these things from the past start to come into your present moment experience, right? Then let's say you gather up the courage to go hiking this weekend. And before you start the hike, you're thinking, I don't know, it's a little bit rainy today. The rocks are slippery. Maybe it's dangerous. I'm feeling kind of tired. Maybe I shouldn't hike. Maybe I should do the beginner trail. Maybe it's not good for my knee. So all these thoughts about what could be, right, the future, start to happen. Now we know that when the mind kind of goes off into the past or goes off into the future and starts to worry, so we're basically just talking about worry here, worry can actually make pain worse. So forgetting about that physical capacity we spoke about before, forgetting about the strength, the range of motion, forgetting about the wet rocks or what the surgeon said, worry can make your pain worse. So simple exercise I do with people is an acronym called STOP. It takes literally just 10 seconds, and it's just stop, take a breath, observe, and then proceed. So the stop is easy, right? So the stop literally is stop whatever you're doing. So if you're on the hiking trail, you just stop. The T is take a breath. That's one nice deep inhale and exhale. We can do that together, Sam. Just take a breath in and out. And exhale, good. And now the observe, there's two parts to the observe. So it's observe what's going on outside of you. So right now, you might want to observe, let's say, the light in the room you're sitting in, or a sound you hear maybe other than my voice, or the sensation of the chair on your back or the back of your legs, and what's happening in your feet and your palms right now. Then the second part of the observe is what's happening inside. So notice one thought you're having, and then notice if there's any kind of emotion that's present in your body with that thought. And then proceed. The proceed is just go on with whatever it is that you're doing. So what that little stop is, literally that stop is a pause to kind of give your mind just a brief reset and say, okay, where's my mind right now? Is it in the past? Is it in the future? Because if I can bring it right back to the present, so present moment awareness is one of the core processes that we train and ACT. If I can just bring people back to the present, then I can help them kind of regulate their nervous system, help with some type of pain modulation or pain control.
That's very interesting because it's such a simple thing. And the first thing that my experience was right there was whatever I was doing, I was now shifted from, right? Because in order to answer those questions, I had to go inside and I had to shift my perceptions, right? So in a way, it sounds like a very quick pattern interrupt, right? Of somebody kind of going into that state, especially if they repetitively do that. Mm-hmm. And if that doesn't happen, I can imagine that pattern plays out repetitively all the time, right?
That's right. So, these patterns continue and we reinforce these patterns. So a lot of what we're doing with ACT type principles, and my book is full of these little kind of very small, brief exercises because they work really well in practice, and they also work really well for people when they take them home, because everyone's looking for something that's kind of short and simple and quick that works. And these short, simple kind of interruptions, as you mentioned, these kind of behavior breaks, do help retrain, because obviously we're retraining the nervous system, or we're retraining the brain, working on neuroplasticity. They help in a way that's really useful, because people don't necessarily want to sit down and talk about their pain for an hour.
Yeah.
They're like, okay, I get it. I have pain. I understand that I have a sensitive nervous system, and my brain and my nervous system are doing this. Okay, now teach me how to retrain this. Education really only is like a tiny, tiny first step to that. Some of these other techniques really kind of go much, much deeper with training, retraining thoughts and emotions, and ultimately your behavior, ultimately working on a behavior change.
I feel like there's a lot of opportunities for this. And to just give you a brief example of what I used in my practice was with massage therapy, and the way that I was originally taught was very aggressive. You know, as a lot of kind of structural therapies are, you're breaking up adhesions and scar tissue. And the more I realized that what I was really doing was making the nervous system feel better and safe, I shifted my technique. And in particular, one as simple as that when you glide upon some tissues, whether it's on the lower back or whatever, and somebody has that little twitch response, you know, it was a little bit of like, ooh, that was sore. If you continue to grind on it, it causes more and more tension, and it causes more distress, versus pushing on it enough that the person goes, yeah, I could feel that. And I just have them take a breath. And in particular, I give them a sigh because it seems to kind of work better. And when they sigh, I go, well, what happened to the tenderness? And they go, well, it's decreased. You took your finger off of it. And I'm like, it's the same. Mm-hmm. So, but if you massage over and over again and you keep hitting that tender spot, it's kind of like it plays like a record. You know, a person will always feel that tenderness, rather than giving them an opportunity to engage with it, right? As having, and it sounds very simple in my mind, I can't stop thinking about it. It's the same thing. I give them a stop moment, just did it some slightly different, to just give them an awareness that they have some kind of input or contribution to how they're responding to that sensation.
That's right. That's right. And all throughout medicine, we have, and really culturally, we have this idea that we shouldn't have unpleasant thoughts. We shouldn't have unpleasant emotions, and we shouldn't have unpleasant sensations in our body, things like trigger points and you know, parts of our muscles that feel unpleasant when you massage over them. So there's this idea that, well, I'm not supposed to have that experience, therefore I have to eliminate it. And in the case of, you know, kind of an older, I would say, outdated massage technique, which you're not using, Sam, you're doing something that's quite intelligent. You know, the older way would be, well, I'm going to rub on this knot until it goes away, so to speak. I'm going to break up this adhesion and separate the muscle fibers, and it'll eventually go away. And that probably doesn't work with most people, right? So instead, what you do is you kind of engage the patient and you say, hey, let's work on this together. There's a spot here that's a little sore and unpleasant. Let's see if we can kind of just become curious about what's here and experiment with it and open to it in a way that's healthy. And instead of looking at it as something bad, let's look at it as part of our experience and see if that changes. And you don't have to change a whole lot in the experience to change the sensation of the muscle, so to speak. Just a deep breath can be the thing that changes it. So I like that. And that's actually very ACT consistent. And I actually encourage more manual therapists, whether they're PTs or massage therapists, to approach the body in that way, where we're becoming curious about what someone is experiencing in their body, rather than saying, oh, here's something that's unpleasant, i.e. bad, and I'm going to eliminate it, or I'm going to teach you how to eliminate it, because you probably have tight spots in your body, Sam, just like I do, and we're both health professionals, and we work on our bodies and we're healthy, but some of that's like a normal part of life. But if I approach that part of my back, let's say, as, oh, that's the bad part of my back, or that's the bad part of my lower back, then what you're really doing is you're saying, I shouldn't be having that. So how can I shut down my experience around it? Where pain becomes a paradox, and this is the paradox of ACT, as we become more open and aware of what's happening in that area, the sensation is likely to decrease rather than closing down or becoming unaware of that part of the body actually makes pain increase.
That's very interesting. And I had some thoughts about that a while back, though, and kind of the direction that I take my work, which is not deliberately engaging with pain. And I think a lot of therapists are looking for, in particular, provocative factors for pain. So if I rub on someone's back, I'm going to find that one area that's generating their pain or whatever. And most often, especially with chronic pain, because that's where my area is, where a lot of people are working, you can't reproduce it. What you do is you can push on areas where that pain is oftentimes at, but you're never really reproducing it unless you're putting the person into a context, a situation, et cetera, where it's kind of happening. But what I'm trying to do is to give that person a sensory input that is different, that feels safe, but allows them to engage with the area where the pain is normally felt, but non-painful ways. And also the trigger point phenomenon, which is the thing, which is still kind of, the field is evolving, but there's still an overemphasis on things like trigger points. Virtually everybody has trigger points. They are generally kind of irrelevant. I think what matters is that we push on them and the person unloads that semantic meaning and all that emotion that's associated with that trigger point actually being a problem. It doesn't really ever go away, but the person's association and what they feel when it's being pressed on changes. And I think that part is the therapeutic part that a lot of people fail to grasp because they think it's a mechanical phenomenon that you're actually releasing a trigger point or something is occurring in there when it's really the nervous system's perception of what is happening that's really shifting. And I think that's the part that I really think that, that is missing with the aggressive therapies. And aggressive therapies have not changed really that much. I think practitioners are becoming more aware of this, but there's still a lot of people that do tear the meat off the bone type of massage work and any kind of manual therapy, which I don't have a problem with pressure. If people enjoy having a lot of pressure and that means to them that it feels good, but I think that's different from somebody being, dug on and put through a lot of discomfort because the intention is somehow that some mechanical process is occurring that's going to get them out of pain. I think that's completely different.
Yeah, you're right. We don't really know enough about trigger points. The way I kind of look at a trigger point when people kind of work on them, kind of the way you're talking with kind of the kneading and the knuckling and the elbows and things like that. I look at it as like, really you're exposing someone to pain. And we actually know that exposure is a technique actually. And when you expose people to pain, sometimes the pain goes away.
Yes.
Because people say, I don't want the pain. I shouldn't have this pain. I can't have it. And then you expose them to it. And what your brain says, okay, there's pain here. I feel the pain, but other than the sensation being unpleasant, I'm not hurting myself, right? I'm not being damaged more. So then your brain starts to modulate that experience down and says, all right, there's still pain there because, there's a 200-pound guy with his elbow like leaning into my multifidi in my lower back. It doesn't feel very good, but I'm not being damaged, so to speak. So you're exposing someone. It's actually pain exposure, which is a part of ACT and a part of most pain approaches in physical therapy. There could be an exposure element there that we haven't really studied yet on a manual therapy level, which is interesting to think about. But ultimately, what we're doing as clinicians is we're trying to change people's behavioral patterns so that they can kind of confront what's happening and cope with what's happening to them. So when I say behavior, people think the things you do with your body, maybe your mouth, like speaking and moving your body, that is a behavior. But so is thinking. Thinking is a behavior also. It's a process that's happening in your body. It's a behavioral process. So are emotions, right? Emotions are a behavior as well. Before, when you mentioned, leaning into the trigger point and some people having like an emotional release, which people talk about. ACT itself is based on a theory called relational frame theory, which basically means your mind makes all sorts of different connections. So if I said to you, coffee cup, well, let me just say cup first, right? What do you associate this cup with? I kind of gave the first one away, right?
Right. I would say I make a picture in my head of Folgers coffee, and it's
Okay.
fairly transparent because I drink espresso. So I'm like, oh, that's kind of transparent coffee.
Right. So right there, you've actually made probably three different associations. You associated with coffee, you associated with Folgers coffee, and you also associated with another drink that is coffee. It's espresso. It's just a more shorter, concentrated type of coffee, right? So your brain makes associations, and it makes associations in multiple directions with multiple different things in life. Now, if you start to lean on someone's trigger point and they feel physical pain, right? Well, we also know that in the brain, the emotional parts of the brain overlap tremendously with the parts of the brain that track physical sensation as well. So people start to have an emotional response because their brain is saying, oh, there's pain here. What else is happening in that part of my brain right now? Well, I lost my, grandparents last year and I really miss them. And there's that kind of sensation, that coming together that happens. And people have an emotional release because you're placing a physical stress through them. And as I mentioned before, the same can happen when someone's depressed. When someone's very depressed from losing their grandparent, then they can develop tension, let's say, in their shoulders, and you have a physical response to it. So it's really interesting to talk about these connections and talk through them, because it helps people understand, wow, my mind or my brain has an impact on my body, and my body has an impact on my brain.
Yeah, and so the probably the take home point with that, as I see, is why all of these professions and disciplines really have a lot of overlapping themes. So I'm very curious to see where this all goes, probably because it still feels like a young discipline. And most of the people that I talk to are very unfamiliar with this. It's, the internet's making things easier to access, and easier to find. And thanks to that is how I found your information. But getting this information into more and more people's hands, to it becomes more of the standard way of approaching things, rather than be something that seems to be so difficult to find and so difficult to access. So I'm definitely happy that you're doing trainings on this and teaching practitioners how to do this. So let's chat about how we can get access to more of that information. So first and foremost, the book I believe is open to virtually everyone. Obviously, practitioners are going to learn a ton from the book. The book's called Radical Relief, by the way, A Guide to Overcoming Chronic Pain. But this really looks very much like a user-friendly guide for anyone who's dealing with chronic pain issues. Yeah.
Yeah, I mean, the book it's a workbook, so it's not like a book where you sit down on a Saturday and read it for 6 hours on a Saturday. It's a workbook. Each chapter is only about 1 or 2 pages. So in essence, I'm giving you an exercise to do. I recommend that people do 1 exercise a day. And if you did 1 exercise a day, you probably would be done with the entire book within about 30 days. And you would put yourself through really a similar pain rehabilitation program to what you receive if you would come to see me in person. So there are different types of mindfulness exercises. There are writing exercises. There are reflection exercises. Some of it's just education for learning and pain education, as we spoke about. But I wanted something that was very approachable for, obviously, first, someone who was struggling with pain, because people with pain aren't going to sit down and read a 300-page book, right?
No.
You want pain relief within a relatively short period of time. And then even for practitioners, we're all busy as practitioners. Sometimes you don't want to read a big textbook. So I've made it approachable. And in that book, there's a guide for people with pain that explains how to use the book. And there's also a guide for practitioners that explains the underlying theory of mindfulness and acceptance-based intervention. So, you can all find that on Amazon. But again, some practitioners actually use the book in practice, where what they'll do is they'll actually go through an exercise with their patient. The first part of the session takes about 10 minutes maybe. And then the rest of the 20 minutes, they'll do manual therapy, exercise, whatever it is that they're doing in practice. So that's the way a lot of practitioners use it. If you're someone with pain, as I mentioned before, you can just pick it up and read 1 small chapter. It's 1 or 2 pages each day, and take yourself through that, self-guided program.
I find that, there's the do-it-yourselfers, but there's also those people that, want to chat through things and to process stuff. And I think that
Yeah.
tends to be part of the issue a lot of times when people have chronic pain, is that they kind of want to walk through it with people. Now, I would imagine, so you have practitioners that you train. Is there an easy way to find practitioners that are immersed with this content, they use this content that can help people?
Some of them you can find on my website at the Integrative Pain Science Institute.com. I do have a practitioner portal there. So you can find people who have taken my Act for Chronic Pain course and successfully completed that and have a background in that information.
Awesome. And you've got some other stuff that's out as well, and certainly not limited to just to the pain science and the ACT program and therapy and so forth. You talk a lot about nutrition as well, which is awesome. And do you have a course on that one as well?
I do. Nutrition is another bodily process that's important, right? We have to feed ourselves or fuel ourselves with healthy nutrients, and without that, our bodily processes, including our nervous system, don't work so well. Yeah, I do have a course. It's called Functional Nutrition for Chronic Pain. It's a certification that is appropriate for any licensed health professional.
And that's another area. And I know that nutrition studies appear to be notoriously difficult, right? Because you have to track people on eating behavioral patterns and so forth. And I know the challenges with that, but it's definitely something that hasn't been kind of like, the pain education, everything else has had its peak, as we talked about, and started to kind of level off. Now, maybe we'll start to see an uptick in the amount of information on nutrition and chronic pain as well. And those have been listening to my podcast. My wife is a clinical nutritionist, and her expertise is in gastrointestinal disorders for the most part. And we had an episode where we talked a lot about inflammation and how big of a situation this is. And as a practitioner, we want to try to acknowledge and identify people that are dealing with these underlying inflammatory situations, which can make your work so much more challenging to deal with. I mean, giving people too much exercise, adding on new things that can be stressful for them because they're dealing with this kind of underlying source of inflammation, which is just triggering their nervous system and creating a whole lot of stress behind the scenes.
Yeah, I mean, chronic pain is a neuroinflammatory condition. So there's inflammation in the nervous system. And people don't make the connection, but there's a connection between your gut and your brain. That's a direct connection. There's also an indirect connection where things pass through the blood-brain barrier. But nutrition is vitally important for people healing from chronic pain, especially those with an autoimmune condition or any kind of condition that impacts the nervous system, which really, nutrition pretty much impacts the nervous system with every bite that you take. So there have even been studies on looking at, we've already talked about some cognitive behavioral techniques, but there have even been studies that have looked at when people have proper nutrition, learning happens in a way that is more fruitful. So ultimately what we're doing with pain education, and even with the ACT and other cognitive behavioral techniques, is we're helping people learn about what's happening. And without that, if your nervous system is offline because you're just feeding it sugar all day long, or processed foods which are nutrient poor and don't have the essential nutrients that you need, it's very hard to promote neuroplasticity. Neuroplasticity requires nutrients, and the more healthy nutrients you feed your body with whole nutrient rich foods, the healthier nervous system is going to be, the healthier the patient you have in front of you is going to be.
And all the more reason to drive home the point to work with practitioners who have at least a big picture understanding of all of these pieces being involved. That what comes to mind for me is that if you're just drilling down one thing, structural biomechanics or only nutrition or only the cognitive behavioral work and you're not getting the results you want, maybe you have to step back just a little bit and spread it out a little bit. You might be missing some other components that when you cover those, you can go back to that other therapy and make even more progress with it. So I think that's a key piece here, and working with especially practitioners like yourself who are pulling all this together to just kind of get people the overall understanding of what's going on. You're not going to do it all in one day or overnight. It's something you chip away at, but make sure you have an awareness so that at least you can recognize when there might be inputs that are contributing to your chronic pain, that so you don't dig yourself or don't go too far down any one rabbit hole without paying attention to some of the others, right?
Yeah, I like that, Sam. I like that you can take that kind of multi-dimensional perspective. That's really what we need more. Right now, people are just looking at one component, as you mentioned. And really, there are multiple processes that work here. And when you start to train or rehabilitate those multiple processes, that's when someone notices the change happening in them.
And all we want is results. We want people to get better. That's the key. And if we're always looking out for their best interest, I think that's easy to do. It's just a matter of finding practitioners around us that can help us do the work, right?
That's true. It is difficult to find people who are up to date on the latest pain science, but with podcasts like this, we help people understand that there is a difference between kind of the old way we used to treat pain and the new way to treat pain, where people do reap the benefits from it in a faster amount of time.
Awesome. Well, in final words here, because I'll let you go. I know you're a busy guy. We'll wrap up our time here, but let's throw out your website one more time. Make sure people know where to get more information about this. I'm, of course, going to include links down here, but website is, again, one more time.
Sure. Everyone can find out information about me and the courses and books I have at the Integrative Pain Science Institute.com.
Awesome. All right. Thanks, Dr. Joe, for being here and sharing all this great information. And of course, we'll push everybody toward the direction of getting radical relief here, because they need to know this information. And I hope everybody's enjoyed the podcast.
Thanks so much, Sam.